Senator Clonan, 10 minutes.
And I think the challenge I'm going to have is not to get emotional during this. And I want to say, before I ask you your questions, there's nothing personal in this. I know that each and every person here is a good person who's trying to do their best. But collectively, ladies and gentlemen, something has gone terribly wrong. And it is a scandal of international dimensions. So, this report, which you haven't published, is absolutely shocking. My son had spinal surgery in Temple Street in 2018. If I had known about the contents of this report, I would not have given consent. Because this report shows you're operating a three-ring circus with the language that's in this, a toxic, broken culture, abhorrent work practices. And let me be really clear. The rogue consultant narrative that you're relying upon is only a symptom of the problem. And it is stated over and over again in this report. The problem lies with the senior leadership team, executive and board. You are the problem. And you must take collective responsibility for that. And that's my first question. Will you take collective responsibility for that? And in the conclusion of the report, it says, a substantial and persistent message of concern over apathy regarding the lack of management and leadership and good governance, along with poor operational oversight and accountability, came through very strongly during this examination. There is a lack of trust in leadership in being able to adequately challenge and address the issues raised in this report, which you are refusing to release. So my next question is for you, Dr. Henry, and I'm sorry to have to address this to you, but bearing in mind the contents of this and these conclusions, do you have confidence in the senior leadership team and the board who have presided over all of this harm to transition 3 children's hospitals into CHI? Because I don't. I would not allow my child to be treated in the environment that's set out and described. And I am not, I'm sorry to say, I'm not at all reassured by your responses. Sorry doesn't cut it. And when I was in with this committee, Dr. Goldman and Dr. Okafor, and I described the circumstances of my son's surgery and how late it was and how traumatising and unnecessarily so it was, you were aware of all of this and you did not inform the committee of the risk factors that were there. So I'm not convinced that you're fully open and that you're invested in open disclosure. It's clearly not the case. So there's 2 questions there. Do you accept responsibility for this? And I don't want an apology. I'm not finished. Sorry, Ms. Nugent, I beg your pardon. And then, do you have confidence, having heard what's in these reports, for this? I mean, if you were running Tato Park, I wouldn't let my children go there. It's as frank as that. Who is doing your public relations and crisis communications? What company does CHI employ to do your crisis comms and your public affairs and your public relations? And how much of our taxpayers' money are you paying them? I have a few more questions. In this report, there is a very alarming issue around the urological waitlist. And there's a cohort of patients known as the Clonan orphans who are not receiving treatment from a urological surgeon with higher specialist training for the transitional pathway treatments that they need. That is absolutely extraordinary. These are children who need surgical procedures that are routine in other jurisdictions on their little penises, on the reproductive organs of teenage girls and teenage boys. How many, now those children, according to the report, are reaching the transitional pathway to adult services. How many of those children have become infertile due to a lack of surgical intervention? Now, if you make a mistake, if you go to the bathroom, and you know the way you have 2 switches, one is for the fan and one is for the light, and you accidentally turn on the fan. I meant to turn on the light. That's a mistake. But this is a systematic and systemic failing of these children on the urology wait list. And I raised this last year in the Shannon. In January, I raised it several times, and the Minister refused to come into the Shannon for my commencements. And it was reported by some of our journalist colleagues here. I am absolutely shocked to think that we have de facto sterilisation of disabled children in this country. That's shameful. and that is an international scandal, of proportions that I struggle to find the vocabulary to describe that. So you tell me how many children have become infertile whose reproductive capacities are compromised for a lack of timely surgical intervention. The other question I have is in relation to other reports that are buried and that have not been published. If you could give an undertaking to furnish me with the Dixon report, please, by way of the committee. I'm not finished. And those other reports that you mentioned. Because how can I give, or how can any of the parents here give informed consent for their children to be treated by you if they don't have the full facts about the actual circumstances and the risk factors that you preside over? And let me be clear. You as a board and as a senior leadership team, and you're very highly remunerated, and you've competed to be in those positions. You can delegate authority, but you cannot delegate responsibility. You are responsible personally, individually, and collectively for everything that happens or fails to happen on your watch. And saying it was like that when I got here is not a defence.
Senator, we'll need time to respond to that.
Thank you.
So, in relation to accountability, yes, thank you. I do accept accountability, as I said.
No, responsibility.
And responsibility.
So what are you going to do? How are you going to discharge that responsibility? Just carry on?
No, and that is why I have reconfigured our executive structures, and that goes right down from executive level to clinical director level to clinical specialty level, so that we can actually ensure that we are, number one, measuring the right things, and it's not about outputs, it's about outcomes. That we are actually, there are issues that we deal with them quickly and head on.
So again, like this report, I never hear the word children or parents. I hear measurements, quantitative stats, this, that and the other. If we could move on to the other questions, who's doing your PR?
We actually manage our crisis management, etc. internally. We have a communications department. We have a Q4 company on retainer monthly. So, for example, we would have had a session with them to prepare ourselves today.
Yeah, and how much are you paying them?
It's, I don't know the exact figure off the top of my head. I have to come back to you.
Will you send that to the committee? Because the rogue consultant narrative, you're getting value for money, I have to say. I say that with, you know, I'm very disappointed to see that narrative being, I mean, absolutely, this is a systemic and systematic failure at board and executive level. And you are not fit for purpose. And I am very alarmed that you retain, that you purport having, you know, what we know, that you purport to be trusted to transition into CHI. I think that's going to be a major risk event, and I trust that. I'm glad to see that the HSE have intervened and stepped in, because you know this needs oversight and needs to be very carefully managed, because it's harm to children that we're talking about. And again, very quickly, I don't know, Dr. Goldman or Dr. Okafor, can you tell me how many children have become infertile due to a lack of timely intervention in the urological pathway?
Dr. Goldman will answer that.
I'm not aware. It's impossible to say.
So you don't know. Wow. You don't know. And you do know that, and I know, Dr. Okafor, that you know the consequences and the implications of children not receiving timely intervention on the urological pathway. So you don't know. What do the parents think of that? That is shocking. Shocking. Because I have highlighted this in these houses of the Oireachtas on behalf of the people who've elected me here, who've given me a mandate. We have put this down on the record. I have all of my contributions here, at least a half a dozen contributions where I warned about the lack of surgical interventions on the urological pathway, which is routine in other jurisdictions. And Dr. Goldman, as I said to you the last time, you come from Great Ormond Street. Are you not shocked at what you find here in this republic in terms of the suboptimal outcomes for children in CHI?
Just 30 seconds remaining.
Look, Senator, thank you for your questions. I came here from Great Ormond Street with huge optimism about the prospects of the new hospital and bringing everything together. As issues arose, and many were legacy, we instituted as open as we could, reviews
Yeah, this word legacy has been used repeatedly, but you don't know how many of our children have become infertile due to a lack of timely intervention. And again, it's like the light in the switch pan. That's not a mistake. That is an ongoing, systemic and systematic failure of our children. Disabled children being de facto sterilised for lack of intervention on your watch, and you don't even know.
Thank you, Senator. Sorry, we're actually out of time on that slot. What I would say is there's a number of unanswered questions there, and I would ask maybe the witnesses might write to the committee to answer some of the questions we didn't get answers to, if that's agreeable.
Certainly.
Correct.
I mean, if you like, Dr. Goldman could give some feedback on the issue that Dr. Clonan has raised, because we did actually look at scientific evidence, consult with the urologist, etc.
We will, and I think the committee will agree that we will engage again in the near future with you on this and to get answers to some of the other questions. So I'd like to thank CHI, the HSE, the Department of Health for an engagement with the committee on this issue. And as I say, the committee remains concerned about the serious issues, and we'll consider it further. And as I say, I expect we'll be in touch again. So now we will adjourn the session. Next meeting in public session is a meeting of the Select Committee with the Minister for Health, Jennifer Carr-McNeill, to consider the estimates for public services for 2025 and vote 38 of Health. The joint committee's next meeting in public session is Wednesday, the 2nd of July 2025. Can we bit order, please? Order. The next meeting, it has been agreed of the Joint Committee, will meet in private session at 3:15 on Tuesday, 24th of June on MS Teams to consider correspondence and other committee matters. Adjourned.